Hey everybody, how's it going? I hope you're doing well and your studies are going smoothly. Welcome back. We're going to do some more psychology revision today. We're going to look at psychopathology, and it's going to be the behaviourist treatments, or the behaviourist approach to treating phobias. So that covers systematic desensitisation and flooding. Okay, so here are some exam style questions. I've put timers up there for you. If you've got the time and space and you're ready, do have a go at some. And then pause the video, come back, and I'll talk through. All right, so here's your chance to pause. Okay, right, let's crack on. So identify, you're just going to tell me a behavioural treatment. So this is a really nice, easy question. You're going to bank a few extra seconds here if you're getting this in the exam. So just tell me flooding or systematic desensitisation. Done. Okay, we've got a 2 marker, just some knowledge on flooding this time. So flooding involves intense or immediate exposure to the phobic stimulus. So credit for talking about the fact that it's intense. And you also need to get in the fact that it's about using relaxation or breathing techniques that you'll have taught the client. Okay, so it's intense exposure to the phobic stimulus whilst using some taught relaxation and breathing techniques until we have unlearned or mastered the phobia. Done. So the second one is a question about systematic desensitization, but it's specifically asking about the hierarchy part of it. Okay, so a fear hierarchy is a technique used in systematic desensitization. It involves the client and the therapist working together to produce an ordered or kind of ranked list of steps towards mastering the phobia. It might start with imagined or kind of like a picture kind of contact with the stimulus and slowly build as the client is ready towards actually being in the room with the phobic stimulus. Yeah, and they would relax until they've mastered each step. Okay, so it's the idea of that gradual exposure. Okay, here's Emmy, and if you've watched the previous video, you'll be familiar with this little scenario already. But here, the trick is that it's asking us about treatments, okay? So you could cover both, or you could cover one. Because it's an application question, you're probably looking towards maybe 3 knowledge, 3 application marks. Yeah, so it's up to you. Bit of a depth versus breadth thing. I might just go for systematic desensitization because there's a bit more to say about that to stretch up to those 6 marks. So, one way of treating Emmy's phobia would be to use systematic desensitization. So a therapist would work with Emmy to teach her breathing techniques, relaxation techniques, ways to focus on her muscles and on her body so that she is focused and relaxed and calm. And the therapist would then work with Emmy to produce a fear hierarchy or a desensitization hierarchy. For example, this might start with pictures of farmyards, pictures of goats, build up maybe, well, you might actually start with pictures of cartoon goats. Let's start there. That's a bit more low-key. And then you might build to pictures of real goats, and then you might build to watching a video of a goat. Then it might be having contact kind of, outside a pen, kind of, looking over a fence or through some kind of enclosure at a goat. Then it might be standing up next to a goat, and then it might be stroking a goat or sitting down with a goat. Give, don't have to give all of that in this question, but give maybe 2 or 3 examples of how that hierarchy would look, yeah, so that you're getting those application marks. At each stage, so for example, when looking at the video of a goat, Emmy would have to put into practice those breathing techniques and those relaxation techniques until she has mastered that step, and they would move on at her pace and until she has met all of those levels of the hierarchy and unlearned her phobia of goats. Okay, so don't forget to apply that breathing element as well. Yeah, so at each step of the hierarchy. Okay, we've got a distinguished question next. So the key difference is immediate versus, or intense versus gradual. So flooding involves intense exposure to the phobic stimulus at its worst while trying to relax for a long period of time until that fear has passed. Whereas systematic desensitization involves gradual exposure to the phobic stimulus. It would be much more client-led and therefore more ethical, and it would take more time, than flooding would, okay? So the key difference is, as I said, the gradual versus intense, but what I've thrown in there just to stretch that up to try and cover all 4 marks is maybe it's a bit more ethical, maybe it takes longer, yeah? So more kind of differences between them. Okay, so this is an evaluate question. It doesn't necessarily feel like that, but it's about, comparing the two. So why is SD better than flooding? Okay, it's not automatically better. Flooding is actually more effective for some people, but we can't talk about that because that's not what the question asks. Why is SD better? Well, some people would prefer systematic desensitization because it goes more at their own pace. Some people would say it's more ethical. So therefore it might be better because actually we're going to have fewer people dropping out of it, which means that actually if they continue with it, it's more likely to be effective for any one given person than flooding is. Yeah. So even if flooding is overall slightly more effective for some people, if you started with say 100 people, you'd end up with more of them finishing if they were doing systematic desensitization. Yeah. Okay. Now we want to discuss a limitation of SD. So again, to discuss, we are introducing a limitation, but then elaborating on it, maybe giving a counter argument, yeah, to present the other side. Okay, so we just talked about how good systematic desensitization can be in terms of ethics and carrying on with it and, not having attrition, so not having people drop out of it. So what's bad about it? Well, perhaps the bad point is that it takes a long time, yeah. So one limitation of systematic desensitization is that it takes a long time. It takes several sessions. Well, this can cause, costs to increase because time is money after all. So you could talk about the economic implications to elaborate on this. You could talk about funding in the healthcare sector. You could talk about the financial burden on healthcare services. So maybe it's not feasible economically in the long run. However, the limitation might be, the counterpoint to that limitation might be if we're saying, okay, it takes time and it costs a lot of money. However, given that it's more gradual, actually we might see more people more likely to finish that treatment or persevere with that treatment. So actually in the long run, it might save money or save resources. If you, as I said a couple of minutes ago, if you started with all these people doing flooding, you might invest less money in that, but actually if half of them, if 3/4 of them, whatever, drop out, all of that money was wasted. And potentially you've actually made their phobia worse because they've just avoided it in the end. So it might be, this is kind of the counterpoint, isn't it, for this one? It might be that, yes, you have to invest a little bit more money to do the systematic desensitization, but investing that extra bit of money means that people actually finish the treatment and therefore that makes it justifiable economically. Yeah? So cost-benefit analysis there, yeah? The benefits might outweigh the costs. Okay, 8 marks, describe and evaluate flooding. Interesting here, in your response, refer to an alternative. So we're looking probably for reference to systematic desensitization in there. It's not really a comparison question. You could do some comparison because that would be credited as evaluation. But all we have to do really is just make 1 or 2 brief references to systematic desensitization. So earlier we talked about why SD might be better than flooding. So we could lift some of that into this response as well. Okay. But in terms of breaking this down, we want probably 4 marks for describing it, 4 marks for evaluating it, and we want our knowledge to be detailed and accurate with specialist terminology. We want our evaluation to be thorough and effective. So to describe it, you're going to talk about the fact that it's intense exposure. You're going to talk about the relaxation and breathing techniques. You're going to talk about the fact that it might be over 2 or 3 hours until that initial fight or flight response has subsided, and we unlearn, or we kind of counter condition the phobia. So after a while we kind of are not having this negative association with it, we're having a neutral association with it. It's going back, if you like, to being a neutral stimulus as opposed to a conditioned stimulus. Yeah, that's the whole point of flooding. In terms of evaluating it, it maybe is a limitation of it, maybe is how intense it is and maybe how unethical or traumatic it is for some patients. So that could be a limitation. That's a really nice opportunity to bring in the alternative, SD. So we talked about that one earlier. Maybe that's a more ethical, maybe it's more acceptable for patients, maybe they're more likely to continue with it. You could even throw in the fact that actually potentially there's a waste of money there if people drop out of flooding. Maybe use the word attrition there, which just means dropping out, in terms of getting that specialist terminology in there as well. Okay, so that's a limitation. But a strength. Okay, so research tells us that flooding is actually better for some phobias than others. Yeah, so phobias that are more kind of, again, I'd mentioned this in a previous video, kind of ancient fears, things that are more like, phobia of snakes, phobia of spiders, things like that. Actually, research tells us that flooding might be more effective for those. Yeah, so that's a real strength. Yeah, but to discuss that, some research actually disagrees with that. Some research tells us it doesn't really matter as long as you're kind of persevering with it. So there's some discussion points there. Do not forget, as we said, to refer to systematic desensitization at some point. Ideally, a bit more than just naming it, because that will just be a very limited reference. So do, as I suggested, kind of have that little bit of a discussion with it's better because or it's worse because, that sort of thing, yeah. To flex that up to be 16 marks, here it's a slightly different question, isn't it? Because actually you're going to get knowledge marks for flooding and for SD. So kind of think of that as maybe a paragraph on each. Yeah, so kind of 3 marks on each possibly. And then for your 10 evaluation marks, you're probably looking for maybe 3 or 4 discussion paragraphs. I would probably go for 3 because I would try to counter-argue to kind of stretch that up a bit to be into level 4. We've talked about lots of points already. You could talk about attrition rates and dropout rates, how traumatic or unethical flooding is. You could then move that into a bit of comparison with systematic desensitization. You could have a discussion about how for some phobias flooding might be more effective. You could have a discussion about for some phobias actually SD might be more effective. So there's research telling us that for more kind of complex phobias, things like social phobia maybe, then systematic desensitization might actually be most effective. Yeah. You could talk about how a limitation or a shared limitation for both of these is maybe they're only focused on the learning element. Yeah. So some research suggests that there are biological or cognitive elements to phobias. So actually maybe bring in an alternative as part of your discussion. Yeah. So a limitation of both is that they only focus on behaviorist elements. And as I said, research tells us that biological and cognitive factors are involved. So maybe a more appropriate way of treating phobia is to introduce an element of CBT, to try to identify maybe the irrational thinking that comes with phobias and try to target that and change that and dispute that. You could also, as I said, go down the biological route. So something that would also potentially be appropriate with some phobia patients is to try to target the stress and anxiety, maybe using anxiolytics or kind of sedative drugs. So if you've done OCD, you'll be aware of things like benzodiazepines, I imagine. So kind of anti-anxiety, anti-stress drugs. Yeah. So the point with this discussion paragraph is that you're saying, flooding and SD are good, but they're not the complete package. Yeah. They're not 100% effective. I think I mentioned earlier, they're about 70 to 80% effective. So how are we going to do better than that? Maybe we need to bring in these other kind of treatment modalities. Maybe we need to bring in some drug therapy to target the stress. Maybe we need to bring in some CBT to target the irrational thinking. Okay, I think that's enough to be getting on with. Okay, how did it go? What happened? Why did that happen? Reflect. How was the timing? Did you have to have a cheeky sneak peek at any notes or books or anything? So what are you going to do next? How's that going to feed back into your next steps, into your revision? Okay, thanks very much, guys. I hope that was helpful for you. Please do ask a question in the comments if you like. Good luck. Keep going. You got this. Bish bash bosh.